For more on the Ebola epidemic and its treatment, we're joined by Polly Trexler, a director of operations at Johns Hopkins Hospital. Polly, thanks for joining us.
Sure, I'm glad to be here.
So tell us about these Ebola training modules that Johns Hopkins and CDC have put together. What does that mean exactly? What is it?
Yes, we were approached by the Center for Disease Control and Prevention, and we partnered with them to produce some training videos on the use of personal protective equipment to care for Ebola patients.
If you're in go ahead, I'm sorry, go ahead.
Go ahead. So we pulled together a team with representatives from the Center for Disease Control, Johns Hopkins Medical Institution team, including epidemiologists, infection control preventionists. We had some human factors people involved, and the project involved making training videos for all of the different personal protective equipment combinations that people would use at various facilities to care for Ebola patients.
So is this training video already online? People can access it?
Yes, it went online last Monday, so it's available worldwide on the CDC website.
So what happens if, let's say, someone is in a remote part of Africa? Will they be able to access that? How functional is it?
Sure, as long as they have access to the internet, which this day with global technology, most people do have access to the internet, and as long as they have access, they can sign into the or log on to the CDC website and have access to these training videos, watch them. They're broken up into modules so they can pick specific videos and tailor it to the personal protective equipment that they would use in their facility. So they, for instance, they could pick a video, a training module that uses mask and face shield and gown. There's training modules for facilities that might use a PAPR and a Tyvek suit. So there's a number of different combinations that different facilities would use, and they can use that to specifically train their staff at their facility.
So what is the idea behind it? Is it to protect healthcare workers from contamination?
Absolutely. So personal protective equipment works to prevent staff and healthcare workers from Ebola, but the key to prevention is to wear the personal protective equipment exactly as it's designed, and the most important key is to remove it properly and carefully. So these videos were written to ensure that every step is followed meticulously. We've designed it so that the team uses a checklist and reads out from the checklist. So, for instance, it would be, now put on your gown, and then the next step, put on a pair of gloves, put on booties. So there's specific step-by-step instructions. Since it's a video, you can see exactly how to put on and take off the personal protective equipment. And as long as people have access to a computer, and they can look at these videos wherever they are around the world.
All right. Thank you so much, Polly Trexler. We certainly hope the videos help.